Hey there guys, my name's Kody, I live with schizophrenia, and as many of you know, I'm on a long-acting injection, or an LAI. I wanted to make a video about my progress because I've been on an LAI for a while now and there's been some recent changes and updates. And I want to share more about this journey because I, like many patients, didn't know what LAIs were or how they affected people, so I just want to give insight to my own experience. Just a disclaimer, medication and treatment are a very individualized process. So what works for me might not work for you or your loved one. This is just about my own lived experience. Also, this video is sponsored by Johnson & Johnson for educational and awareness purposes. This a lot in the past, but throughout all of my years making content, I was on and off of a lot of different antipsychotic medication. And it was a lot of trial and error to try to find what worked best for me. It wasn't until a year or two ago that I made a switch to a long-acting injection. For those of you who don't know, a long-acting injection is something you can take instead of daily oral antipsychotics. It did take me a long time to first try an LAI, but I was on a monthly LAI for quite a while, and the recent update is I switched to a 3-month LAI injection, which means instead of going in to get an injection once a month, I go in every 3 months now. I think it's really important when talking about medication to remind people, especially patients who might be watching this, medication isn't always a cure-all. A lot of people still have breakthrough symptoms with medication, and that's the case for me. Even with the medication I'm on now, even though I have very little symptoms, I do still have symptoms. And I do experience some negative and cognitive symptoms as well. My next video that I'm filming is actually about all of my negative and cognitive symptoms, not just what I experience now, but what I experienced before I was medicated as well. There are a lot of really amazing medication options out there, but for me, this has been the best fit. As many of you know, I don't talk about brand or dosage when I talk about medication because I want patients to work with their care team and their clinical care team to find what works well for them. A lot of people see how high functioning I am and they'll think that if they can duplicate my medication, they'll have the same result. And unfortunately, that's just not how brain chemistry works. That's not how medication works. Everyone has their own experience. Now, for my personal journey, I have had less side effects and less symptoms. So before medication, I was pretty much having constant hallucinations, delusions, and paranoid thoughts. After I started daily oral antipsychotics shortly after my diagnosis, it gave me more clarity, but I was having a lot of side effects. I was still struggling with an increased amount of auditory and visual hallucinations back then. But after working with my psychiatrist for years, I finally found a good mix of meds that allowed me to be pretty responsive throughout the day, but it also reduced the symptoms I was having. So I went from having auditory and visual hallucinations, delusions, and paranoid thoughts constantly just to having some breakthrough symptoms of auditory and visual hallucinations. My delusions and my paranoia pretty much went away. Now, that doesn't mean that I don't ever struggle with those issues, but it's something I don't experience much thanks to medication. And this was all before my current medication. This was already seeing improvements. I was already doing better. I was already gaining insight and finding stability. And at this point, when I was starting to make content and I was starting to do my advocacy and travel around, I was still having symptoms maybe a few times a week, which may sound like a lot, but from going to constant symptoms, basically whenever I was awake, I was having symptoms, to having symptoms a few times a week for a couple hours, it was a really big impact and it was a huge difference. And so for a while, I didn't change my meds because it worked and it was allowing me to have more freedom. It was allowing me to have less symptoms. But like I said, I still had some side effects. I had a lot of issues with weight gain. One of my medications even gave me tardive dyskinesia, which is a movement disorder. Fortunately, as soon as I quit that medication, I stopped having those side effects. So I did struggle here and there, but overall, my life was improving. It was getting better. Once I started my LAI, I went from having symptoms a few times a week to a few times a month. So now, because I do travel a lot and there's a lot of things I've had to consider with how often I take medication and how much of an impact it has on my life, I've been really fortunate that I do have less side effects and now I'm having less symptoms too. This has been really great for me as I travel. I talked about this in the very first video I made about transitioning to a long-acting injection. I was very hopeful that it would lead to less symptoms over time, and that's what I've seen in my own experience. I've been really grateful because aside from just having less symptoms and having less side effects, I've been able to be a little more functional day to day. Once again, I want to remind everyone watching that this is my own experience with medication, and you or your loved one might have a different experience. So have a conversation with your doctor before quitting any meds or trying new medication. I just think it is important to have these conversations so we can see what's working for patients. A lot of us start our journey as patients with very little information. We don't know what to expect. We don't know how medication is going to affect us. All we know is what we see and what we hear, either from our peers or from people online, or unfortunately, the news and TV shows and movies. So we go into this with not a lot of understanding of what we're going to be dealing with and what's going to help. So I wanted to share a little bit about my own experience, but I want to remind you guys, please talk to your doctor, talk to your psychiatrist, talk to whoever you work with to try to find the best fit for you. Medication isn't one size fits all, and it does take time. I spent years of trial and error trying to figure out what would work best for me, what allows me to live the most full and functional life. And so I'm really grateful to be able to give this update and tell you guys that things are going really well, and it's allowed me to do more speaking events and travel more and work on my book and be able to do all of these incredible things. And I want to remind you guys that I'm not only here fighting stigma about mental health and mental illness, I'm also fighting stigma about medication and treatment, because I know that a lot of people grew up in areas like I did where it was rural communities, and people really look down on individuals who have to take medication for mental health. So I think this topic is super important. I would love to know if you guys have any questions for me. Once again, I don't want to answer any specific questions about brand or dose. This is more a question about what to expect, how to know if medication is working, how long to wait, things like that. Let me know if you guys have any questions down in the comments. Be sure to like and subscribe, and I won't be able to answer all your questions because, once again, I'm not a doctor, I am not a psychiatrist, I am just a person living with schizophrenia, but I will do my best to answer any questions I can. For specific medical questions, please talk to your care team, talk to your clinical care team, talk to your doctor. The more open you can be with your doctor or psychiatrist, the more they can help you in the journey through medication and treatment. Thank you guys so much.